Other comments, and I say this because I've seen crazy things, and I feel like I need to put it out there so people can know and advocate for themselves. Some people think because you have IIH, you can't have an epidural. That is not true. You can have an epidural, okay? Actually, it probably will help with your headache. So you can have an epidural. Patients can deliver vaginally. People think because you're pushing, that may put too much intracranial pressure and cause you to have issues with worsening visual acuity. That's usually generally not the case. There's a couple of exceptions to that. Meaning if a patient needed a diversion surgery because they had such high intracranial pressure that they're having visual loss, and they refuse to do it during the pregnancy, which means that your intracranial pressure is high, then you may need what's called an operative vaginal delivery, meaning once your baby is complete and crowning, we may need to do something like a vacuum assistance, meaning it's like a little suction we put on the baby's head, and then we help you by pulling the baby down the birth canal or back down into the vagina and out while you are pushing so that you don't have to exert as much intracranial pressure. The other alternative is to go straight to C-section so that you won't push at all. But that's only with people that have extremely severe intracranial pressure, signs and symptoms of papilledema with evidence of vision loss. Those are usually the only people that cannot deliver vaginally. Of course, if you have other reasons for needing a vaginal a C-section, like you've already had a C-section before, or if you have had a myomectomy or any surgeries on your uterus, then obviously those are reasons that you may need a C-section. But if you don't have anything else going on and you have IIH, you can deliver vaginally unless, like I say, it's an extreme case. The visual outcomes are actually the same during pregnancy as they are when you're not pregnant. Okay, so pregnancy is not going to worsen the progression of visual loss in people with IIH. That is not true. They usually do the same. So if you had worsening visual acuity before pregnancy, it's going to progress during pregnancy. So it's better to get a preconception consultation and get that treated before pregnancy if possible. And then the rate of miscarriage is not increased with IIH. People with IIH have the same rate of miscarriage as people without IIH. This does not increase your risk of a poor pregnancy outcome related to stillbirth or miscarriage.